Sa pong masayang umaga sa inyong lahat mga kaibigan. Ito po muli ang inyong palatuntunan, AdventistMed Facebook Live. Nahatid po sa inyo ng Adventist Medical Center Manila at mula po dito sa Lifestyle Medicine Department. Kami po ay nagpapasalamat at bumabati sa inyo ng isang malusog at magandang umaga po sa inyong lahat. At tayo po ngayon ay magpapatuloy sa pagbibigay daan sa Women's Month, ngayong buwan ng Marso. At ang ating pong pag-uusapan ay para po sa mga kababaihan. At pwede rin naman ito sa mga kalalakihan. Po? Pero bago po tayo magtungo doon, tayo po muna ay manalangin. O Panginoon naming Diyos, kami po ay nagpapasalamat sa inyong kabutihan at sa inyong pagmamahal sa bawat isa sa amin. Ngayon po kami po ay makakatunghay ng isang lektura sa kalusugan upang kami ay mas lalong maging malusog at matulungan ang may mga problema sa ganitong kalagayan. Lalo't higit ang aming mga minamahal na mga kababaihan. Niyo po kaming samahan at nawa ito pong aming programang ito ay patuloy na maging pagpapala sa lahat ng aming mga tagapakinig at taga-subaybay. Ito pong aming dalangin sa pangalan ni Jesus. Amen. So dahil po Women's Month tayo ngayon, ang ating pong maririnig na lektura ay tungkol po sa headache in women. So ako po naniniwala, napakarami nating kababaihan. Kaya ipakita po ninyo ang inyong puwersa ngayon. I-share po ninyo, i-watch party. At ang inyong mga questions and comments ay gayon na lamang ay inyo pong ipadala sa atin para malaman po natin na kayo ay kasama namin sa ating live program ngayon. At siyempre po, ang makakasama natin ay isa pong espesyalista sa neurology. At siya po ay consultant natin dito sa Adventist Medical Center Manila at fellow ng Philippine Neurological Association. Isa po sa ating mga neurologist dito sa Adventist Medical Center Manila, si Dr. Rogie Marie A. Ignacio-Alcantara. Happy morning sa iyo, Doktora.
Happy morning.
At salamat po sa inyong pagpapaunlak at sa ngalan po ni Dr. Linda Limbarona at ng mga bumubuo ng palatuntunan ito. Ngayon pa lang po nagpapasalamat na kami sa inyong pag-guesting dito po sa ating programa. At ngayon po ay hindi na tayo magpapaligoy-ligoy pa. At alam ko marami na ang nakaantabay at naghihintay. Bigyan na po natin ang panahon kay Doktora.
Thank you, sir. First of all, I would like to thank Adventist Medical Center Manila, especially the Lifestyle Medicine section, for giving me an opportunity to share my knowledge to you. Especially ngayon nga, sabi ni Sir, Women's Month. So, when they asked me to give a lecture, I was thinking of what topic should I give. So, then I thought about giving a lecture about women, specifically headache. So this will be a lecture focusing more on the headache, especially experienced by women, starting from their adolescent years, pag nagbuntis, nagbe-breastfeed, and then pag nagmenopause. So kumbaga yung buong lifespan ng women we will discuss here. Okay? So first of all, so I will just start with a sample case. So a 34-year-old woman came into the clinic for a treatment of migraine. It occurred around the start of her menstrual period, although she usually had 2 additional attacks each month. Non-menstrual attacks have shorter duration, but menstrual attacks continued for several days. She describes her headache as unilateral. It means on just one side of the head. Throbbing. Most of the patients will tell yung throbbing parang pumipitik-pitik, parang tumitibok-tibok. So, it is associated with nausea or feeling that you like to vomit, as well as sensitivity to light and sound. Okay? So, during headache attacks, she was disabled by the menstrual headaches as she was unable to continue with the usual activities of daily living. She will just took acetaminophen or paracetamol, which helps with the non-menstrual attacks, but it has little attack on her menstrual attacks. So, yung menstrual period niya was regular, occurring every 27 to 29 days, that last for 5 days. The first couple of days, the flow was heavy, and sometimes it was associated with dysmenorrhea. And migraine usually starts on the second or third day of menstruation. So, sa mga nakikinig sa atin, no, parang somehow, parang
Nakaka-relate sila.
oo, nakaka-ring ng bell, no? Kasi karamihan ng babae, every time magme-mens, they will tell, naku, ang sakit ng tiyan ko, ang sakit ng puson ko, ang sakit ng ulo ko.
Yes.
Ano bang meron, diba?
Yes.
Akala lang nila it's just normal part of being a woman. No? But of course, we'll just have to discuss that. So, migraine is ranked by the World Health Organization as the third, no, most prevalent medical condition if not managed well. So, as you can see here, very disturbing siya and debilitating because it is ranked third. No? So, medyo mataas yung ranking niya na very common. No? So, it is the second leading cause of disability. So, nakakagulat, no? Na yung headache pala can keep you disabled. No? So,
Simple sakit ng ulo. No?
oo, akala ng mga tao, masakit ulo ko, okay na yan. Uwi na lang ako, tulog na lang ako. But of course, they will be disabled with that headache. Okay? So, migraine is more common in women. It does not mean that because it is most common in women, hindi siya nangyayari sa lalaki. No? It can also occur in men, but it is more common in women. And in women, it has a lifetime prevalence of 43%. So, ibig sabihin, all throughout the lifespan of female, 43% of the time nag-headache sila. No? So, na maging babae yata dahil sa migraine. So, migraine can be classified as either migraine without aura or menstrual migraine. Okay? So, they're saying that the migraine with aura as compared to the migraine without aura, it occurs all throughout the lifespan at the start of menarche or at the start of menstruation and up until puberty. Okay? So, kahit nagdadalaga pa lang sila during the start of the menstrual cycle, nakaka-experience na ng migraine yung mga patients. Okay? Migraine is a disorder that impacts women throughout their lifetime. So, from pre-puberty, childhood years to the post-menopausal years. So, simula nang magkaroon sila ng menstruation, hanggang tumanda sila, and even after mawala yung menstruation, they still experience headache. So, women report more migraine-related symptoms and more migraine-related disabilities as compared to men. So, if men will have migraine, most of the time, medyo sabi nila, natotolerate daw ng mga lalaki kasi mas hindi ganun kasakit, no? But in women, it is more debilitating and it's more disabling to them. So, menarche, or the start of menstruation, is a common time for a teenage girl to experience her first migraine, and it is more prevalent in women during reproductive years. Kaya mas common siya dun sa mga 20 years old and above, no? Or pag nag-teens, tapos tumatanda, mas common siya because it is during that time, yun yung reproductive years nila. And estrogen plays a key role in migraine and during times of fluctuation such as puberty, menstruation, pregnancy, as well as the peri- and postmenopausal years. Sex hormones, specifically estrogen, can act as an important modulator, hence the different effects of migraine in men and in women, because we all know that estrogen is present in women. Okay. So, as you can see here, I don't know if you can see, in the graph, so they can see. So, the arrows, yung pababang arrow, yung nagdi-dip down, that is the time when estrogen falls down, bumababa yung level ng estrogen. And during the time na bumababa yung level ng estrogen sa babae, doon na po-produce ang headache, no? And kapag, kailan bumababa ang estrogen? That's the start of menstruation. Kaya madalas, during menstruation, doon nararamdaman, yung headache. So, laging nagtatanong, maraming nagtatanong, Dok, pag ba nagmamigraine ako, nag-i-stroke din ba ako? Nagiging stroke din ba siya? Or pwede ako mag-stroke? 25% of migraine sufferers also experience an aura of transient neurological symptoms. Ano ibig sabihin nun? Before sila magkaroon ng headache, sometimes they experience blurring of vision, para silang nabubulol, nangihina ang isang parte ng katawan, so para rin silang nag-i-stroke. No? So, these symptoms are reversible. Usually, nawawala siya pag nawala yung headache. And most of the time, no, rather, kapag nag-start na yung headache, nawawala yung symptoms. Okay? But in a study, they recently found out that a migraineur who has an aura, ibig sabihin yung may nararamdaman prior to the attack of headache, increase din yung risk niya of stroke. So those patients who have migraine and may aura, increased ang risk of stroke. And the risk depends on the frequency of the aura. It means kung gaano kadalas yung aura, nag-i-increase din yung kanyang risk of having a stroke. So the risk is increased twofold with less than 1 aura per month, and it increases fourfold as if aura is more than once a week. So ibig sabihin, habang mas matagal ang aura mo or mas madalas ang aura mo, mas nagkakaroon ka ng increase of stroke. So dapat, kapag nagkakaroon ka ng migraine or nakaka-experience ka ng migraine, you should really consult your doctor because your risk of having a stroke is very high. Okay?
So ito pong mga stroke na ito ay hindi naman ganun kalala.
Well, depende. Most of the time, hindi natin alam. Yung iba kasi sinasabi, nag-stroke na ba siya or nagma-migraine? So talagang kailangan talaga ng specialist for that.
Yes.
Okay? So, let me just check. Okay. Okay. So the absolute risk of stroke among women of reproductive age has an incidence of 4.3 to 8.9 per 100,000 per year. Ibig sabihin, mataas din yan, no? Kung titingnan natin, parang point something, 4.3 to 8.9. But it adds up or accounts to a lot of cases, no? So the consensus statement, the consensus statement recommends considering non-hormonal contraception in women with migraine as first-line method. Kasi, di ba, sir, usually sa mga health center, binibigyan sila ng mga pills, ng mga ganyan, without even consulting the doctor. Most of the time, yung pag-intake natin ng pills, nagkukos siya talaga ng migraine or headache. That's why we are recommending not to use hormonals, because it greatly affects yung headache ng mga patients.
Kasi commonly na sinasabi doktora ng mga babae, side effect lang talaga yan ng pills. Kaya parang they just get used to it. Yung pala, dapat meron tayong ginagawa.
Dapat. Kasi, sige, sabihin natin, side effect siya ng pills, pero hindi natin alam, baka may underlying problem, na kailangan nating bigyan ng atensyon. Okay? So, women with migraine na may aura, using hormonal contraception, it means may migraine ka na, and then you're using contraception, stroke is increased fourfold.
Wow.
So, imagine natin, ganun kataas yung risk niya, And then, woman with migraine with aura, yung isa kanina walang aura, ngayon may aura. Stroke risk is increased sixfold. So, ganun kataas, If pinagsama mo, may migraine ka na, and then you're using oral contraceptive pills, or hormonal contraception. Okay? So now, let's see about menstruation and migraine. Ito yung pinakamaraming concern, So, menstruation is a significant risk factor for migraine without aura. Okay? The incidence of migraine without aura is greatest during 5 days of the menstrual cycle, beginning 2 days before menstruation, and then continuing through the first 3 days of bleeding. Kaya nga yung mga patients, sinasabi nila, di ba, Dok, may dysmenorrhea na ako, masakit pa yung ulo ko, siguro magkakaroon na rin ako. Parang yun yung nagiging warning signal nila na magme-menstruation sila because of the migraine. And migraine can be either a menstrual migraine, which is a pure menstrual migraine, or what we call as PMM, or a menstrually related migraine, or the MRM. Okay? So, usually, yung mga nagkakaroon ng menstrual migraine occurs in the second decade of life. Typically, wala siyang aura. When you say aura, yung katulad kanina, yung either may nakikita, may naaamoy, or nangihina ang isang parte ng katawan. And the prevalence peaks around age 40. And the prevalence declines habang palapit na yung pagme-menopause kasi nga hindi na siya related sa menstruation. So it usually occurs 2 days prior to the actual bleeding, prior to the actual menstruation, and in the first 3 days of the cycle. So yun yung mga matinding sacrifice, no, during menstruation, yung 5 days na yun. So when you say menstrual migraine, or meron usually premenstrual headache na tinatawag. But ang difference ng menstrual migraine sa premenstrual migraine is that premenstrual headache occurs 2 to 7 days before, no, the onset of menses, and may be part of what we call as the PMS, or the premenstrual syndrome. And it typically resolves within the onset of menstruation. So yun yung main difference, no? Kasi yun nga, pwedeng part lang ba siya ng menstruation or talagang meron siyang tinatawag na menstrual migraine. So if it is a premenstrual headache, which is a part of the premenstrual syndrome, nangyayari siya 2 days, no, before the onset of menses. And nawawala siya pag nag-menstruation. Unlike yung migraine, mas tumitindi siya pag nag-mens. Yun yung main difference nilang dalawa. Okay? And usually, menstrual migraine is less responsive to acute and abortive therapies, and NSAIDs are effective. Ano ba yung mga NSAIDs? Yun yung mga ibuprofen, mefenamic acid, no? Is effective in treating and preventing this. Okay? So, the attacks may occur before, during, or after the menstruation. And usually, it occurs in at least 2 out of every 3 cycles, no, with no migraine. At any other time, over a month, no? So, and it is estimated to occur to only 7 to 35% of women. So, hindi naman ganun ka-common. Pero parang 35% medyo mataas pa din, ano? So, sana sa 7% na lang, no? But it peaks around up to 35%. Okay? The menstrually related migraine in comparison to your menstrual migraine occurs in 60% of women. So, mas marami, no? So, attacks are often more severe, longer in duration, and less responsive to both acute, ibig sabihin yung nagpapatigil ng headache, and prophylactic, or yung nag-control, no, over a long period of time, than migraines occurring at other times of the cycle. Okay? So again, no, katulad nung pinakita ko kanina, estrogen plays a major role in menstruation and migraine because there is an inverse relationship between estrogen and migraine. So pag bumaba ang estrogen, mag-i-increase yung intensity ng migraine or mag-occur yung migraine. Okay? Usually, in my clinic, I give patients this headache diary. Pinaka-important kasi yung headache diary. So, when you say headache diary, para siyang paper, tapos parang tabulation siya, no? Na may daily, no? Parang nakatabulate siya. Ilalagay ngayon ng patient, no? I-check niya kung nagkaroon siya ng headache, no? And then, kung nasabayan siya ng menstruation, bibilugan niya. So, that's what my instructions usually to my patients. Pero kasi ngayon, the association is currently doing a revised headache diary which is specific for our country, no? So, parang nag-shade ka kung nangyayari ba siya buong araw, half day, or what, no? To help the doctors also see the pattern of headache, no? Kung nako-control ba siya or hindi. Most of the time, yung iba, magaling sila, sumusunod sila kasi talagang sobra yung sakit ng ulo nila. So, it helps the doctor treat, no, the patient properly also. Okay? Okay. So, technically, the criteria for menstrual migraine is what I have mentioned a while ago. So, this is the new criteria. So, you have a pure menstrual migraine without aura and a menstrually related migraine without aura. Okay, so the main difference is the occurrence of the headache and the presence and absence of aura. Okay? So, kanina, kung maalala nyo, no, yung case natin na 34-year-old na babae. So, sinasabi dito, succeedingly, ito yung nangyari sa kanya, no? To reiterate, no? Nagkakaroon siya ng headache during menstruation. So, how do we treat menstrual migraine treatment, no? For the guidelines, the first line is naproxen sodium. So, we give it at 550 milligrams twice a day or mefenamic acid. And may be used effectively 2 to 4 days prior to the menstrual migraine and continued through day 3 of menstrual flow. Kumbaga, as what I have discussed a while ago, it occurs, diba, 2 days or 3 days prior to the actual menstruation. And nagko-continue siya up to day 5, no? Palang plus 3 days. Kaya, the treatment will also be like that. So, you give it before and during. So, triptans, including sumatriptan, the only available here in the Philippines is sumatriptan, no? Pero konti na lang din kasi masyado siyang expensive. Parang 200 pesos siya per tablet, no?
Wow.
So, naratriptan is not available here anymore, and frovatriptan, but they are effective for prophylaxis. It means it is effective to prevent the headache. Okay? So, usually if you start on triptans, you started 2 days prior to the onset of the migraine and continued for a total of 3 to 5 days. So, it's the same. So, the standard migraine prophylactic medications may be used for 5 to 7 days prior to the onset of menses and continued through the end of the vulnerable time period for migraine. So, hormonal prophylaxis may also be given to counteract or prevent the drop in estrogen. So, parang isusustain mo or susupplement mo yung estrogen because yun yung nawawala. Usually, we just give it parang last resort kung talagang hindi nag-re-respond with the medications, no? And also, you give estradiol patch or estrogen patches, estrogen supplementation kapag talagang hindi na siya nagre-respond with the current treatments. Okay? So, this is just a tabulation of the different medications that we used for the menstrual attacks of migraine. So, these are also the treatment or the prophylaxis. So, we are very familiar with naproxen, no? So, sa TV, lagi may mga commercial ng naproxen. So, alam natin kung ano siya. Okay? So, during this time, no, the same patient came back to you in your clinic, no? So, nagpunta siya sa'yo, sabi niya, Doktora, no, nag-IUD ako for contraception, no? So, common din yan, no, na ginagawa sa mga health centers, they insert IUD, no, for contraception. So, what is the relationship of your contraception to migraine? So, oral contraceptives are generally considered safe in women under the age of 45. Pero, doon sa walang migraine. Okay? And who do not have vascular risk factor. So, we choose monophasic pills, no? But most of all, it is very important that you consult your doctor first before starting on any medications or any contraception. Okay? So, the same patient, no, was lost to follow up and now coming back to you because she's pregnant. No? So, parang ganun tayo. Una, nag-menstruation. Bigla, sabi niya, ayaw niya magbuntis. Ngayon, bumalik siya sa'yo. Buntis na siya. Kaso, concern siya. Ano daw yung pwede niyang gamot, no? Which is safe for her and safe for her baby.
Yeah, kasi sumasakit pa rin ang ulo.
Sumasakit pa rin ang ulo niya, no? Kawawa naman, ang daming problema, no? So, during pregnancy, majority of the headaches are called primary headaches. No, when you say primary headaches, yun yung mga walang underlying cause. So, like migraine, tension type, yun yung mga primary headaches. No? And usually, these headaches, so parang good news. No? Kapag nagbuntis ka, itong mga headache na to, such as the tension type headache and the migraine, nag-i-improve during pregnancy.
Wow.
So, nawawala. Kaya minsan sasabihin ko sa patient ko, naku, pag nagbuntis ka, mawawalan ka ng problema kasi nawawala yung headache nila. Okay? So, of course, no, we have to take note of the other causes of headache. Lalo na pagbuntis, no, marami kasing iba't ibang sakit or iba't ibang underlying causes of headache na pwedeng mangyari sa mga pasyente who are pregnant. So, minsan, akala natin, baka nga migraine lang yan. But of course, we have to take note, no, baka mamaya nag-stroke din siya, merong nagbara sa ugat, no? Or baka tumataas yung blood pressure niya, nagkakaroon na rin siya ng mga microstroke sa loob ng brain. So, yun yung mga kailangan nating alamin. No, we don't really jump into the conclusion agad na it's really migraine lang. Okay? So, of course, during pregnancy, yung hormonal changes during pregnancy, yung stress during pregnancy, tapos, di ba, pag buntis ka, hirap ka sa pwesto, hindi ka makatulog. So, all of those can contribute, no, sa pag-increase ng, ng occurrence ng headache. And as estrogen levels rise during the first trimester, pwedeng sumakit yung ulo, no? But after the first trimester, usually nare-resolve yung headache nila. So, studies suggest that severe maternal migraine may increase the occurrence of adverse delivery outcomes, no? So, that's why we have to take note of that, and kailangan i-control natin yung migraine during pregnancy. Kasi may study na nga na nagsasabi na pwedeng magkaroon ng adverse delivery outcome if nag-i-increase yung migraine nila during pregnancy. So, kapag ang patient may history of migraine or nagma-migraine during pregnancy, meron din silang elevated risk of having pre-eclampsia, preterm birth, and yung baby nila will have low birth weight, no? So, akala natin talagang migraine is just sakit ng ulo, pero marami pala siyang dalang problema, no, if not really diagnosed properly. Okay? So, migraine that presents first time during pregnancy is usually uncommon. So, kung halimbawa, buntis yung pasyente and then nagsabi siya na may headache siya and it's the first time, medyo red flag siya, no, alarming siya, no? So, kailangan nating i-work up yung patient. Okay? So, during pregnancy, during the first trimester, ang mga considered safe for treatment is small doses of caffeine, no? So, coffee, pwede. And acetaminophen, no? So, it's the paracetamol, no? Yun yung mga considered safe, okay, during pregnancy. So, during early pregnancy, merong several NSAIDs or ibang mga medications are considered safe in pregnancy, but the narcotics, morphine are not recommended during pregnancy for treatment of headache. Okay? Codeine, in some countries, they use codeine in pregnancy. So, they found out that there's no increased risk of fetal malformation in pregnancy. Outcomes of codeine exposed compared to non-codeine exposed pregnancy. But the use of this medication in the third trimester should be cautioned, as there was an increased risk of acute cesarean delivery and postpartum hemorrhage. So we should use the medication with caution during pregnancy. So metoclopramide can also be safe for pregnancy in pregnant women who's experiencing migraine. So women experiencing status migrainosus, ano po yung ibig sabihin ng status migrainosus? Ibig po sabihin, nag-headache ngayon, tapos 3 days na hindi nawawala yung sakit ng ulo. Wow. Kumbaga, walang pahinga. Kumbaga, wow. In short, headache na walang pahinga, no? Prednisone or steroids is recommended because it is generally safe in pregnancy. So, triptans, ergots, and aspirin should be avoided for headache during pregnancy. Okay? So, in some studies, coenzyme Q10 daily is effective for migraine prophylaxis and when taken during pregnancy. But it has been associated with a significant reduced risk of preeclampsia. So, ito po yung mga natural medications, so like supplements, kasi coenzyme Q10. So, magnesium supplements can also be used for migraine prophylaxis and it can also lessen the risk of eclampsia. So actually, there's one medication, it's a combination of coenzyme Q10, magnesium, and vitamin B12, no? So meron po tayo nun dito sa Philippines that we can give safely to our pregnant patients. Okay? So this is just a tabulation of the medications that I have discussed a while ago. Okay?
Sige po.
Sige. We'll run through that. Okay. So, that same patient, gave birth na, and it was uneventful. So, 1 month after delivery, bumalik na naman yung migraine niya. Ayaw talaga siyang patahimikin ng migraine niya, no? So, now, she's asking you, what can she take? Because she's breastfeeding naman.
Yeah, naman.
Okay, so panibagong problema na naman. Kanina, dahil buntis, ngayon naman nanganak, pero nagbe-breastfeed. So, ano bang pwede? So, migraine often recurs in the postpartum period. So, after manganak, bumabalik din siya most of the time. So, but breastfeeding women have a lower recurrence rate of migraine. Kaya we are advising women to continue breastfeeding. No? Kasi it will also lessen their migraine attacks and it will lower the recurrence. Kumbaga, hindi madali ang pagbalik ng migraine, no? So kaya breastfeed lang po tayo ng breastfeed, no? Para kumbaga it's not just helpful or very useful for the baby but also for the mom, no? So low dose aspirin, ibuprofen, acetaminophen, caffeine, no? Kanina pa, no, naririnig natin paulit-ulit, coffee can help also. Okay? So there's a principle of pumping and dumping breast milk for 4 to 6 hours after taking a medication, no? Kasi minsan yung mga mami natatakot sila, Dok, uminom akong gamot, baka mamaya mainom din ni baby.
Yes.
No? So, para magkaroon ng additional reassurance si mami, so you have to pump, no? And dump 4 to 6 hours after. Ano pong ibig sabihin nun? Halimbawa, uminom po siya ng gamot, then kailangan po 4 to 6 hours after taking the medication, pwede po siyang mag-pump, tapos hindi po niya muna papainom kay baby. Para medyo mas kampante rin si mami, no? After 4 to 6 hours. So, ano po ba yung mga medications na hindi po pwede during lactation or during breastfeeding? Aspirin, atenolol, nadolol, zinaricin, flunarizine, no, yan pong mga yan, hindi po sila pwedeng ibigay during lactation. Okay? So, another tabulation of the medications na pwede pong gamitin, no? Nakalagay naman po dyan if there's a risk or if we use it in caution. Okay? So, definitely, yung mga may X, hindi ho talaga pwede, and yung C. Okay? So this one are the prophylactic agents naman that we often use during lactation. Okay? So on subsequent follow-up of the same patient, she verbalized, no, na baka daw pag tumanda siya, ganun pa din. Kasi parang hindi naman nawawala. So she's asking now for the opinion of the doctor, anong pwede niyang gawin for this concern? Kasi pag tumanda siya, baka andyan pa rin yung headache niya. Okay. Migraine tends to improve with age. Okay, so that's a relief somehow, no? So, but perimenopausal transition can give rise to a temporary worsening of headache. Okay? So, halimbawa, from being nagme-menstruation ka, tapos yung common na sinasabi nila na parang naglalayag daw yung menstruation, no? Yung parang nagiging abnormal siya. So during that time that there's a transition from a regular period to an abnormal and irregular period, pwede pong mag-worsen yung headache, mainly because of the fluctuations of the hormones in women. Okay? So during perimenopause, it can be associated with fatigue also, insomnia, most of the patient will have irritability, night sweats, hot flashes. So all of these also can contribute to increasing intensity of headache. Okay? So for women, we can give paroxetine. So we usually give it paroxetine and gabapentin, no? Especially for the perimenopausal women na nag-complain of headache or increasing severity of headache. So in summary, migraine is a lifelong disorder, no? Kung makikita natin, no, yung parang yung pasyente natin, simula nang nag-mens siya hanggang sa tatanda siya, no, meron pa rin siyang headache. So because it is a lifelong, no, lifelong problem, often beginning just before puberty and then continuing after menopause. Okay? Through standard migraine abortive and prophylactic therapies, including hormonal options, majority of women can experience improvement in their migraines and associated symptoms. So, menstrual exacerbation of migraine is common, particularly during perimenopause or before menopause. And if symptomatic treatment is not sufficient to manage the condition, prophylaxis can be offered to your patient. And the majority of headaches occurring during pregnancy and lactation are benign and likely to improve with minimal intervention. So, nawawala naman din po siya, especially if you continue breastfeeding during lactation period. But it is very important to assess a pregnant patient with headache. So, a very good history and for us to determine or to know, no, the warning signs and symptoms for us to give proper intervention and management. And also, it is very important to minimize drug exposure in women, no, who are planning pregnancy or who are at high risk for unplanned pregnancy. So, the choice of medications is very important. Kaya it's very important for you to seek consult, no, to your doctor Kasi yung choice of medication will be different from, for example, iba kay letter A, iba kay letter B, iba kay
Yes.
letter C. Kasi most of the time, di ba, yung mga patients, like, ay, kasi ginamit siya nung
Kumare ko.
kumare ko, so baka pwede rin siya sa akin. So, hindi ho, no?
Effective kay
Iba-iba.
kumare.
Oo, iba-iba ho. So, I think that's my take-home message for everybody, no. Headache is a serious complaint that needs to be to be looked into deeper, no. Hindi lahat ng headache pagod lang tayo, no. Merong mga ibang headache na nagwo-warning sa atin na may iba pang mga problema.
Okay, maraming salamat po Dr. Rogie. At ngayon po, bigyan daan natin itong mga comments, mga questions and greetings natin. Ito si Ma'am Carlota EF. Sabi niya, ang fresh naman ni Dr. Rogie, idol, no? Ang ating president, Dr. Makaya po, nanonood.
Thank you po.
Si Ma'am Marilyn, si Ma'am Franca, Ma'am Eden Ilisan. Tapos si Ma'am Olivia Andrade, sabi niya, may Tagalog daw ba yung migraine with aura? Ano daw yun sa Tagalog?
Actually po, wala po siyang direct Tagalog translation. Pero kung itatagalog natin siya or papasimplihin ho natin siya ho yung migraine. Kumaga, sakit ng ulo po, pero bago ho kayo magkasakit ng ulo, meron ho kayong ibang nararamdaman. Yun ho yung aura. Kumbaga, parang warning. Parang warning, you'll be having a headache after this. Parang ganon. So, ano ho yung mga aura? Yung iba ho, may nakikitang estrella, no? May mga between na nakikita. Yung iba ho, may naaamoy. May pasyente ho ako, sabi niya, Dok, ba't ganun? Parang nakakaamoy ako, parang may sunog sa kapitbahay. Then after 1 hour, ang sakit-sakit na ng ulo ko. No? So, yun ho yung mga aura, parang warning, mag-headache ka na. So, uminom ka na ng gamot.
Pwede rin ba, Dok, yung sakit sa ngipin?
Minsan ho, meron hong ganon. Yung parang kakaiba yung may iba ho, namamanhid lang yung kamay, tapos mag-headache, no? It can either be visual, so paningin, auditory, may naririnig. Yung iba ho, may patient ho ako, nakakalasa ng bakal bago mag-headache, no? So, iba-iba ho yung talagang nararamdaman nila.
So, mayroong parang underlying cause.
Opo.
Then po, si Ma'am Arya Sampulna, at saka si Ma'am Ellen, no? Nanonood. And then, si Ma'am Lani Magdato. And then, ito si Ma'am Andrade din. Sabi niya, when I bend my back a bit to the right, I feel something heavy at the right side of my brain. Pero pag sa left naman daw po, wala.
Okay. Yung po, usually po ang headache, no? Meron ho tayong mga tinatawag na yung medyo kailangan nating bigyan ng more attention, no? So like yung sinasabi po ni Ma'am, no? Usually po kapag ang headache po is related to changes in position, I think it's better for you to consult your doctor. Baka kailangan tayo lang kahit magpa-CT scan or MRI, no, just to check. Kasi usually po kapag yung headache is related to changes in position, ibig sabihin may ibang nangyayari. No? So we have to investigate more on that po.
Okay po. Si Macario Santiago, salamat po. Si Ma'am Janet Mendoza, sabi niya, paano daw pag nawalan na po ng gatas ang ina after 2 months lang na nagpasuso? Is this due to headache or pwede rin pong...
Usually po, yung sa gatas, usually it's hormonal mainly hormonal, no? Kung bakit nawawala agad yung gatas or hindi. But kung related po siya sa headache, no, usually pag nawala na po yung gatas nyo, most of the time dun bumabalik yung headache. So, kaya nga po we highly encourage breastfeeding kasi habang mas nagle-let down po, nakakatulong din siya ng recurrence ng headache.
Iyon po, ano? And then si Doc Linda, sabi niya, thank you Dr. Rogie for making things clear for us. Mabuhay ang mga kababaihan sa buong mundo.
Opo, mabuhay ang kababaihan.
Tapos si Ma'am Eden Lumbao, sabi niya, I'm already a senior but I always suffer pain every day, especially early in the morning.
Opo, ilang taon na po ang senior? Sorry.
Mga 60 to 65
Siguro 60
po.
to 65, no? Baka po, no? Depende po yan. Baka ho sa pagtulog ninyo, no? Affected din ho sa pagtulog. Yung position sa pagtulog, minsan kapag pangit yung position, pwede ho nagkakaroon ng spasm or paninigas ng mga muscle. Kaya pag gising, may masakit.
Okay. Si Ma'am Amelia Garcia and then si Sir Tenorio Dudes, no? Doc Rogie is the best. So, yan po ang ating mga kasama, ano? At kayo po na mga nakasama natin, alam ko po marami kayong mga kaibigan, kaya i-share nyo po ito mamaya para yung mga hindi nakapanood, kasi this time 10 to 11 doktora is a very busy time.
Oo nga po.
So, yung iba nanonood after office work, ano, or sa gabi pag uwi sa bahay. So, hanapin nyo lamang po itong ating Facebook page para marami po ang makapanood at makinabang dito sa ating napakinggan ngayong araw na to with Dr. Rogie Alcantara. Ngayon po, bago tayo matapos ay magpatalastas po muna tayo. Panoorin po natin itong nalalapit nating programa dito sa Lifestyle Medicine Department, ang Lifestyle is Medicine Intervention Program. Panoorin po natin to.
Lifestyle is medicine. L is for laughter, the stress reliever. I for interaction, the friendly immune booster. F is for food and fluid, the taste of health and the thirst quencher. E is for exercise, the preserving power of motion. S is for sleep, the body restorer. T is for temperance, the key to balanced life. Y, your faith, the divine healer. L is for light, the energy giver. And E, environment, the lifesaver. Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. Indeed, lifestyle is medicine.
So yan po ang ating Lifestyle is Medicine Intervention Program, ang sariling ating programa po, design for sa mga tao pong may karamdaman na or mga wala pang karamdaman at gusto nating maging healthy ang ating lifestyle at maayos yung ating mga chronic diseases. Matulungan po tayo sa pamamagitan ng natural way. Ano po? Siyempre meron tayo diyang mga health lectures, cooking demos, and then group discussions, at siyempre ang ating pong mga sariling doktor, no? Mga diplomate of International Board of Lifestyle Medicine ang ating pong mga resource speakers dito. So yan po ay magsisimula na sa March 16. Yan. So ngayon po, bago tayo matapos ay gusto ko pong pasalamatan sa doktora. Muli, maraming salamat
Pwede
po.
ba akong may idagdag?
Po,
In
sige
relation
po.
to lifestyle, kasi yung nakita
Yes,
ko nga,
yes,
no?
sige po.
Migraine po kasi is very related to lifestyle.
Yes.
Technically. So,
Mhm.
tamang-tama po, no, lifestyle medicine tayo, nandito tayo, tapos di ba nagpo-cooking tayo. So, medyo yung pagluluto natin, less preservative, no?
Yes.
Which is very useful for migraine, no? Dapat walang betchin, hindi masyado malasa. So, it's very related. So, kung may migraine kayo, better din, no? Punta dito sa lifestyle para maturuan din ng proper cooking, ng walang preservatives, and
Wow.
healthy eating, no?
Yes, salamat po. Yung natural na lasa ng pagkain,
Yes,
no?
opo.
At walang masyadong mga kung ano-anong winiwisik-wisik
Oho,
o kaya
tama.
nilalagay-lagay, no?
Tama
Salamat, doktora, no?
Opo.
Ito po ay nakaka-apekto din sa migraine, sa
Opo.
headache. Okay? So, ngayon po, bago tayo matapos, ay gusto po nating iwanan itong talatang ito, hindi lamang para sa mga kababaihan, kundi sa ating lahat. Ito po ay sinulat ni Haring David. Sabi niya, Psalm 119 verse 50, my comfort is in my suffering is this, no? Your promise preserves my life. So, napakaganda po, no? Na kahit merong tayong, sabi nga ni doktora, this is a lifelong
Disorder.
na nararamdaman, no, ng mga kababaihan mula puberty, mula teenager hanggang katandaan. Pero sa tingin ko, women are still blessed.
Yes, of course. Definitely.
Kahit may perks kayong migraine sa inyong buhay, doktora, no? You are still blessed because God is so dear and so close to you. No? Hindi kayo pababayaan. No? Lalo tigit kaming mga kalalakihan, dapat hindi kayo pabayaan. Suportahan kayo, mahalin, at alagaan. So yan po ang diwa ng Women's Month. kaya walang Men's Month eh.
Oo nga.
Only Women's Month. Kasi po, kayo ay napaka-espesyal. So maraming salamat po. Nawa ay makita natin itong migraine na to na may pag-asa, no? May solusyon. Merong gamot at meron ding natural na paraan para po ito ay maibsan. Kung hindi man mawala, doktora, no? Ay maibsan man lang. Kasi meron ako mga kilala talagang pag inatake, kulang na lang daw, iuntog nila yung kanilang ulo sa pader. So, yun po ay merong paraan. No? Tayo magpakonsulta at tayo ay patuloy na manalig sa Diyos. Tayo po muli ay manalangin sa ating pagtatapos. Minamahal namin Diyos, maraming po salamat sa pagkakataong ito. Kami po ay natuto at nalinawan sa mga bagay-bagay tungkol po sa iba't ibang klaseng migraine na maaring mangyari sa isang kababaihan. Ngayon din sa amin mga kalalakihan. Amin pong patuloy na inilalapit ang aming mga minamahal na kababaihan, patuloy po silang pagpalain, patuloy silang bigyan ng kalusugan at tulungan po sa kanilang mga sufferings kung meron man gaya ng migraine. Salamat po kay Dr. Rogie Alcantara at patuloy siyang pagpalain sa kanyang ministry at paglilingkod bilang isang doktor. Ito po ang aming dalangin at pagpapasalamat sa pangalan ni Jesus. Amen.
Amen.
Okay? Marami po salamat sa inyong pakikisama sa ating napakagandang naging talakayan ngayong araw na to. Nawa po, ito po ay ibahagi natin sa iba, i-share natin para po marami ang makinabang. Muli po, hanggang sa susunod pong edisyon ng programang ito, AdventistMed Facebook Live, ito po muli ang inyong lingkod, si Wilson Sia, nagsasabing, lifestyle is indeed a medicine. Maraming salamat po and Happy Women's Month.
Bye-bye po.